Hello, good afternoon, good morning, good evening and welcome. My name is Richard Isherwood. I'm a registered nurse and my clinic's in the UK. It's called No More Earwax. Thanks for watching today. Now, this earwax removal, it was actually a friend of mine who was actually a paramedic. Works for the NHS amongst many other things. I actually know him as well because, as some of you might know, watch some of my other videos. Me part-time, I'm a rugby league coach. You might want to look that up. Those of you in America, it's a much better sport than football or NFL. We don't buy helmets and all that type of stuff. Proper sport for proper men. Anyway, now most of these procedures I do by myself, but I thought a special treat today. I'll get one of my colleagues to narrate it with me, because it can get a bit lonely sometimes here. And if some of you are thinking, colleagues, I thought he just worked by himself, it was just him. But no, I do have another colleague, so if you'd like to introduce yourself, just say hello.
Hiya, my name's Bob. I'm another nurse.
So yeah, that's my colleague there. Got a nice weekend?
Yeah, belting, thanks.
Brilliant, good. So what do you reckon to this wax so far from what you've seen of it?
I think you're in for a challenge. It looks really dry. Not going to be an easy one.
Yeah, it is. It looks extremely dry, It's flaky, and it's very particularly difficult to remove these ones normally. I did try a few tools with this one, didn't we? What did we try?
I think you tried the ear hook, didn't you?
We did, but why did we have to stop that?
Yeah, he's finding it a bit tender. It's a bit uncomfortable, wasn't it?
Yeah, it was. It's finding it a bit uncomfortable. Now, whether it's because of how far back it went or that, I suspect more to do with the pressure that it was placing on the ear canal. Not that one. This one was relatively straightforward.
Yeah.
This wasn't totally blocked. It was the next one. So you've seen we've already got that one out there without too much of a battle. It's just left a little bit of remnants around the outside there, which we're just going to slowly peel away from the edge and pop that out. But yeah, it was the other one that gave us a right battle. I did have to try some tools. There's no recording of us using any of the tools because, they didn't work. And it wasn't in there for very long anyway. Now, some earwax removal practitioners prefer some methods than others. There's a time and a place for all of them. You know, you probably don't see me using tools as much as some others that you may see out there. Everyone has their own preferred way, you know. I'm not saying I'm not a fan of tools. I find it easier and usually more comfortable for the patient. There's more things that can go wrong with tools, not the things that can go wrong with microsuction. But when it's particularly hard and you're trying to stick something in it, you've got to bear in mind that sometimes if it breaks away, you know, you might well catch. If you're having to pull you might well catch the patient on the way out or do a little graze or what have you. So we did try with this one to try and get an ear hook down the side, didn't we?
We did.
Yeah. But just found it slightly uncomfortable. It was quite tightly packed as well, so it was hard to get it in around the side. So I got it in around the side and tried to gently rotate it. Even just to rotating it around to embed it, I felt that was tender. So even the slightest movement of it that wasn't pulling it out, it was quite uncomfortable. So yeah, we knocked that on the head. So we're just going to have to persevere with this, aren't we? So how do you think I'm doing on this one so far then?
I think you're making
Do you think I'm doing all right?
Yeah, I think you're making a bit of a meal of it, mate. Get on with it.
Making a meal of it. He's probably right, to be fair. So yeah, it does look very, very dry. I think we're going to introduce some olive oil very shortly.
Good idea.
Because you can see just how dry it is.
It's sticky.
And it looks like it just needs a bit of encouragement to get out. We get a fairly reasonable grip. It's just really stuck because it's so tightly packed in. Suspect it did go a fair way back. Well, you'll see it will when we bring the plug out at the end. Obviously, as some of you know, there are some bends in the ear canal, and it's not just a case of getting hold of this and pulling it out because the ear canal's not always straight. So the reason why you'll see, and you grab hold of it, you see some wiggling up and down, side to side. You're trying to manoeuvre it around these bends. It helps to work it around these bends and get it out. But you can see the consistency of this. The majority of it is probably skin, dead skin debris material, which is part of the reason why it's quite dry. You know, I don't think the chap had done much prep with any oil before.
I don't think so.
Or if he did, it wasn't obvious. So I think it's just at this point. There you go. So you can see it's slightly glistening. Made it a little darker as well. We absolutely filled it full of a few good old sprays of olive oil spray.
Drowned it there, mate.
And hopefully it helps me get a bit of a better grip. As you can see when we grab the bottom of it, and what I'm hoping to do, I'm trying to see the whole thing move a bit more. Now, like I said, it was uncomfortable. I think it was in between this point and the last one where we just tried to sneak a hook in at the side there. And it's why I'm probably being a bit more slow and a bit more cautious at the moment. Because like I said, did feel that was a bit tender. So I'm just gently trying to give a little wiggle.
It's moving a bit.
Like I said, slower than ordinarily. And as soon as I felt it was managing that all right, you could be a little bit more vigorous with the wriggle. You can already see it's changed some of the consistency of it underneath there. It looks a bit more jellified, and that's what gets a better seal.
Jellified?
From the suction tube onto the wax plug itself.
What's that mean?
So hope you all had a nice weekend. What did I do? I've forgotten. Very, very little actually. Very little on Saturday. Lads had a game of rugby on Sunday, which was yesterday. It's Monday today, and yeah, we had a really good win. The team that I coach, really good win. So yay to Parkside. That's what they call it, Parkside Pirates. And we had a really good win. Good game of rugby.
Up the Pirates.
Most of these are referee as well. You might call them umpires, or whatever you call them in America. And yeah, it's a bit of a thankless job. You're always getting shouted at by people on the sideline and the kids on the pitch too. But hey, no ref, no game. Someone's got to do it.
It's always you though, isn't it?
Someone's got to do it. So as you can see, it is slowly moving. You think I'm still making a meal of it?
100%, mate. Should have been here by now.
Yeah, I think you're probably right. It is slowly moving, which is why we're persevering with this. I mean, if it takes a bit longer, so be it. But it's all about patient comfort. You've got to make sure there's nothing uncomfortable. And each little wriggle, it does slightly move. Even if it's a millimetre or two out of the ear canal, at least it's moving in the right direction. You know, we are slowly getting there. Little bits and bats come away. There's a fair few hairs as well embedded in this as well. I think there's a thing you'll see when it comes out. Might even try a bit more oil. I think very shortly.
That's a good show.
So as you can see, I'm kind of grabbing it and trying to pull it up, pull it across, pull it to the side.
Go on.
And yes, it is moving. It's just really reluctant to come out.
Is it coming now?
Really reluctant. You can see how dark it is as well. Again, that tells us how long it's been in there. See the colour of that there.
It's black.
At this point, I mean, you probably could before. You can see with the naked eye, it would actually be sticking out of someone's ear. And at this point, yes, it probably would have been easier to just pop a little tool in there, hook it in, be it the Jobson horn or the hook, and gently slide it out. But for the reasons I said before, it was uncomfortable. We didn't want to risk that happening again. We just decided to carry on with this. And spoiler alert, it did work in the end. It usually does. It's rare that any get past me. I'm pretty stubborn, and I like to allocate a good old time for me for each appointment, just in case things are a bit trickier. And there it is, just about to pop out. Look at the colour of that.
Good one.
As you can see, just let go of it on the way out there.
Again.
That's a beauty. What do you think of that one?
That's a belter. That. Look at all the matted hairs in that.
It's a belter, and look at all the matted hairs tied up in there.
Yeah, it's really good.
So yeah,
well done.
I'm sure this will make the gentleman's job a lot easier.
It will.
Hi, if you're watching. Well, unfortunately, you might have to start listening to people now.
You don't have to.
But wonderful eardrum, nice and clear, less likely to have any problems in the future as well. And there they are. Now you can see on the side of that, see a little flat edge on the one on the right-hand side.
Oh yeah.
Now whether that's actually moved its way up and it was like all the way back to the eardrum, possibly, that might have been what was a bit tender. Or it certainly might have started there and worked its way up. But anyway, I hope you enjoyed that as much as I did, because it was a belter.
It was.
But from me, it's goodbye, and from him,
it's ta-ra.
We'll both see you later. Take care. Ta-da.